the kidneys and their associated organs? Well, you're in the right place. The kidneys are a pair of bean-shaped abdominal organs, which filter metabolic waste out of the blood in the form of urine. The urine then gets funneled into the urinary bladder by the ureters. Sitting on top of the kidneys, there are the suprarenal glands, or adrenal glands. These glands function as a part of the endocrine system by secreting adrenal hormones, which regulate various functions of the body. Let's begin with the kidneys, which are retroperitoneal organs, meaning they lie posterior to the peritoneum. They lie on the posterior abdominal wall, at the level of the T12 to L3 vertebrae, on both the right and the left sides of the vertebral column. The right kidney sits slightly lower than the left one, which helps make space to accommodate the large size of the liver located on that side of the abdomen. Now, positioned superior to both kidneys are the suprarenal glands, but they also have a number of different relationships with surrounding organs. Anterior to the left kidney is the spleen, stomach, pancreas, left colic flexure, and jejunum, while the liver, duodenum, right colic flexure, and ascending colon lie anterior to the right kidney. The right kidney and liver are separated by the hepatorenal recess, also known as Morrison's pouch. Posteriorly, both kidneys are associated with the diaphragm, the psoas major, quadratus lumborum and transversus abdominis muscles, as well as the subcostal nerve and vessels, and the iliohypogastric and ilioinguinal nerves. The left kidney is also posteriorly associated with the 11th and 12th ribs, while the right is mainly associated with the 12th rib. Each kidney has a convex lateral margin and a concave medial margin. On their concave margins, each kidney has a vertical cleft, called the renal hilum, through which renal vessels, nerves, and the ureters enter and exit each kidney. At the renal hilum, the renal veins are positioned anteriorly and exit the hilum, draining filtered blood away from the kidney. Posterior to the renal veins are the renal arteries, which supply blood to the kidney. And posterior to the renal arteries is the renal pelvis, which is the superior portion of the ureters, which go on to deliver urine to the bladder. Now, the kidneys are surrounded by several layers of connective tissue and fat, which protect and cushion these delicate organs. When looking at a transverse section of the abdomen, there is the paranephric fat, which lies superficial to the renal fascia, and then deep to the